This is a really nice technique that you can use in any number of ways. We can assess the superficial front line. We can provide gentle traction to the spine. I use this for pelvic, lumbar conditions, and as a form of assessment as well for various structures in the body. So the first thing you do is you just have them bend their knee. And I may combine this with various points, right? So if I'm treating the low back, left side, then I would do those right points. Or maybe I'm treating the knee with a combination like Ling Gu and Li11. Or if I'm treating low back, I'm using Yao Tong Xue and 22.07, okay? And there's various other point combinations that we could do. If we're treating the hips or the pelvis, we could do, I like this combination too, write this down, Yao Tong Xue, 22.07 with Sanjiao 5. That's we talked about that this morning, I think. And you can combine that with the lumbar points or the neck points, okay? Or we have 33.08 and 33.09 up here, which we also use for hip pain when it's in the glutes around GB30. And I like it for Tai Yang, Shao Yang type patterns of lumbo, hip, pelvic pain, okay? So this technique that I'm about to demonstrate can be used in a multitude of ways for treating the knee, the back, the hips, etc., okay? And I'm also assessing the superficial front line at the same time. So just by doing a technique like this, I'm literally doing 3, 4, 5 things. I'm assessing and treating, okay? So you bend the knee, and then you just grasp your hands like this, and then I'm just providing a gentle pulling force, right? And I'm working up that line. Maybe you've had this done in Thai massage. Have they been doing this for you? Okay. So that's going to put a gentle extension in her spine as well, which a lot of people need. It's very gentle. It's a very small movement. But if someone's in a lot of pain and they're really locked up, then those little micro movements with the needles are really essential. You don't want them moving too fast, too quick, right? So this is a very gentle technique to use for that. And if you find something that's tender, you know, or if they say, hey, that feels really good, then you can just use your body weight and then just pull back. Don't use your arm strength. Lean back into it. How's that feel? Do you feel much? Yeah? So Ben just discussed traction in the ankle, and then this is another Thai massage technique of providing that. Now, if I'm treating lumbar pain or hip pain, bend both knees. You've maybe seen this in the 214 video where I demonstrate this in the 214 class. So I can have these 2 points in for lumbar pain. I'll add Sanjiao 5 if they have problems in GB30 or in the glutes or the lateral line, right, because of the Shao-Yang connection. Or I might have these 2 points only, or I might do those 2 points with, you know, Ling Gu or those 2. These 2 is a really powerful combination because those will get the low back and the Tai Yang channels, right? They also get into the hips, and then 33.08 and 33.09. Amazing for Tai Yang, Shao Yang conditions. And then once you have those, you place them in this position, and then we're going to have them do the bridge in yoga. Do you know the bridge, Pat?
Yeah.
So just like this, but you're going to lift your pelvis up. So inhale up, and then exhale down, and then inhale up, and then exhale down. Now come up. I like to have them do about 10 reps and 3 to 5 sets, or how many ever sets they want to do in a 10 or 20 minute phase when I exit the room and let them do the movement. And if we break this down further, so go ahead and hold that up. Now, she's still going to be working through the psoas here, right? Because we're starting to move into extension. And so if her psoas muscles are in chronic contraction, then by doing that, we're helping to move through the psoas and to release the tightness there. You can go back down.